now you'll hear it. Okay. Welcome everybody to our monthly provider info sharing session. I'm Kara with the SDS training. We also have Delight, Kat, Cassandra, and Damon with our training team is Delight, Cassandra, and Damon, and myself, and Kat is, of course, our care coordinator liaison. This is our monthly meeting for providers to get you updated on different issues and concerns that we have going on within SDS, and and we also take questions and do a little Q&A here if we can. Obviously, the meeting is recorded, so we do put it on our YouTube channel. And what we do after the session is done is we upload it to our YouTube channel, and then we'll send everybody who attended our meeting an email with our presentation materials, whatever they may be, and a link to the recording. So you can either go back and remind yourself or share it with your colleagues as needed who perhaps couldn't make it, which is fine. So I am going to go ahead and share my screen and to our agenda. All right. So this is what we'll talk about today. Feel free to use the Zoom chat as we go. Like the group said before, if you have your camera on, great. If you're gonna be moving your camera around, go ahead and turn it off. Or if you need the bandwidth, you can turn it off. Keep yourself muted in the Zoom until it's time for you to speak. We really, really like it if you raise your hand so we can call on you using the hand raising in the tools that you have available to you in the Zoom. Okay, first thing that we have on our agenda for today. If you are adding a new service to your agency, we've gotten some calls about this and some questions about this. Just a reminder that not only must you certify to add the service, but you also must enroll with Alaska Medicaid. You have to go through Gainwell to enroll, or you won't be able to bill for it. So both have to happen in order for you to bill. They do have different timelines. And it's up to you, the provider, to decide when to begin serving the person. So we have had questions about, I'm certified and my enrollment is in process. Lots of questions about enrollment in general and delays with enrollment. Can I back bill? We get the question quite often. Well, being able to back bill is not guaranteed. There's different situations and different funding sources that people have. It's impossible for me to, kind of give you a rundown of a back billing process because there really isn't one. Like the basic rule is you have to have both in order to bill to go forward in time after the date of both your certification and enrollment, being active. Okay, so just as a reminder about that. You can see.
Kara, I'm just gonna
Yes.
add really quickly to that. So if I do get questions from care coordinators a lot about I can't find this provider, but they're enrolled and certified. Like I can't find them in Harmony. And that happens when a provider is certified and enrolled, but maybe they are adding a new service to their array of services, and that service hasn't been enrolled yet. So it happens that maybe a provider is providing in-home support supported living, but they're now adding DayHab. So they cannot be added to a support plan or an amendment until they're enrolled. And so we're seeing this come up more and more, especially with the delays that we're seeing with enrollment. So plan accordingly. Care coordinator cannot submit a support plan if the provider is not enrolled and certified and they're not popping up in Harmony. Sometimes there's an issue with how we enter the provider that's different. And we look at each one of those requests that we hear that I cannot find this provider individually to make sure that it's not an error on our part. But most of the time it's an issue with enrollment. And so they're certified. Great. That's great. That's step one. You have to enroll. And you have to enroll each service, even if you're already enrolled, you have a Medicaid billing, you've been providing a service, but you're adding a new service. you do have to enroll that new service separately. And it's the same, like Kara said, it may be backdated. I don't want to call it backdated. It may be effective the day you submit the application, but it may be effective on a different date, and we really have no control over that, and we don't know what that date's gonna be. So just be aware of that, and you could always reach out to us if you have questions about the process or you don't know what's going on. And then we do have some more information about HMS Gainwell and enrollment coming up, but I just wanted to add to that. Thanks.
Yeah, thank you. Absolutely. I know care coordinators are pretty good about contacting Kat with questions about, when we can't add a person, or we can't add a service, you can't add a provider. So thanks for giving us that info and explanation. And also a reminder to reach out to us for help that happens. So when we had our care coordinator info share, our colleagues with Gainwell and a few with DPA came to help present Medicaid enrollment. And there's a recording of that. So I have the link here. I'm not going to click on it for us to go see it, but you will share it with you. And if you want to view the recording, it would be great because there's lots of Q&A in there, and it's our professionals from Gainwell giving instructions and talking about the enrollment delays and how to work with that and how they're improving that or hoping to improve that. It basically came down to 2 new forms were introduced in that webinar, and that was earlier this month. One of them is called a contact list, and it's actually titled Care Coordinator Contact List. And the other one is called Contact Information. So the contact list one gives instructions. Don't worry that it says care coordinator, because pretty much it's useful for anybody. It's just that they titled it that. But it'll give you instructions on how to title an email and how to organize your information for them. And the contact information form is because apparently a lot of the delays in enrollment come down to a bunch of things, but one of them is that there's been multiple ways for enrollment to receive information, meaning like multiple places that a provider or providers can send information to them. And because of that, it hasn't really been centrally picked up. So this is why changes in provider information are causing delay. So they're asking our providers to update a contact form that they created so that you can tell enrollment about your agency's contact info, just to make sure that they have that on file and that they can use this info to put together a seamless one-stop portal, if you will. I don't know if it's actually going to be a portal like a real website. I mean, yes, they use their website, but it'll be one contact place so that they can get your information quicker. So the forms were shared with us, and I'll have to stop sharing this one in order to share another one. Let's see if I can make it work here. All right, this is going to be, it's going to seem odd because it says care coordinator contact list, but it could be a provider contact list as well. And it's the only one I have, so here we go. And it said this is new, so you're getting it within a couple weeks of when we got it, if that. So the contact list, we'll give you this. This is for if you have questions about enrollment, the status, document submissions, or general questions, like it says on the left, where you would call or how you would email, right? And the same thing, pardon me while I move things around a little bit here. General claims, enhanced provider services or escalations or training requests. They also have a training team. We work with their professional trainers there quite often. We've had them come and guest speak. So, they sort of do the same thing that we do, but for enrollment, all things to do with Alaska Medicaid billing and enrollment, not actual waiver services and quality of services and who they're for and what they do. That's what we do. But their training unit is great. You can contact them and they'll answer your questions too. And then for home and community-based waiver service assistance, claims, concerns, submission, help, request for help, they have a staff named Sunshine, and there is an email address for you there to contact that particular staff who's specializing in helping our waiver service providers on the Medicaid side of the house. And so they're asking to help organize emails that they get by titling it, or actually subject lining it a certain way. So you would put your provider name goes here. All right, here's a sample name. Then what is the general topic? And an examples of what a general topic would be. And then your provider ID or application ID, should you be a new provider or have an application in process, perhaps for a new service. It'll have some kind of a number attached to it. So that is a good way to format an email to um, help them understand what you need and to filter it through their processes. And this is new. So that's one form that they shared. And here's another one. We will send you all these. So you can be prepared and organized with your info too.
I dropped
This,
them into the chat as well,
oh,
so
okay,
you can
cool. Thank
download
you.
them from the chat. This is the second item that in the list of the chat, you can see the first one's the contacts, and the second one is the form that Kara's going through now.
Okay, awesome. Thank you, Delight. I'll still email them to you just in case you couldn't pick them up for some
Yeah.
reason. It's okay. Okay, don't worry. We'll get them to you. So here's your point of contact update form. So this is going to help Gainwell know who is the current contact info for your agency, right? So they are asking all of our providers to please fill this out. And the instructions to turn it in are probably down on the bottom of the form. It explains who is a point of contact, what is a point of contact, somebody who can be contacted by Alaska Medicaid regarding business processes, right? And it gives you a little list there. So that's who a contact is. All right. Might not be the decision maker, authorized rep, or something like that for the enrollment of your agency, but it's a contact, right? You can add and remove and put in their phone and their email. And then it has a signature. And so who do you send it to? Well, that separately is not on here, but I think you could use the previous document we shared to find a good contact to submit that. And they're asking us to update like that.
I'm looking up the name of the lady that spoke her email, so
Oh
give
yeah,
me a minute.
was it
Yeah.
Sunshine?
It's Sunshine.
Yeah, was
It's
it
her
Sunshine?
name on
Okay.
the email is different, but her name is she
Mhm.
goes by Sunshine, but the name on the email is
It's the
different.
contact of the
Yes.
name Sunshine on
Yes.
the previous form. So if you want to drop it in, go for it. So this staff member, this professional colleague of ours is assigned to help our waiver providers within the world of Alaska Medicaid overall. Okay. So that's pretty great and significant that they've taken leadership on that to help reduce the enrollment delays and whatever else is happening, errors, delays, miscommunication, and to help it go faster. So yeah.
I'm
So
also going to drop in, they're going to be hosting a town hall in a
Great.
couple of weeks, it looks like. Or, well, wait a second. It looks like it's for tomorrow.
It's tomorrow.
I'm putting it in. So
Okay.
it looks like a nice,
And the neat
it looks
thing
like a
about
nice
it,
time to engage directly with them should you want to do that.
the neat thing about that is that I noticed that it came over on the RA messages, which is messages that you can access at any time through your billing methodology. So their remittance advice is what the RA stands for. And Gainwell is really big on informing you through RA messages and remittance advice. Always check those. If you see one, check it. And you can go into it through your provider portal. You can see the archived ones on MedicaidAlaska.com, provider documents, info. RA messages are a thing. So that's how they let folks know about the town hall. So just as a reminder.
I also added a link for just the RA messages that you could go through.
Awesome. Thank you.
That's how I see them. If I remember to check, you know. So.
Yeah,
Thanks,
they're
Kat.
MedicaidAlaska.com is a pretty big website. There's a lot, you know, but if you could find your way to documents and find your way to training, you can definitely find RA messages. But thanks for the link. That works much better than, you know, looking around for it. Okay.
So just to make sure we're clear, the PDF in there that has RA message, that's to register for the town hall that's tomorrow. But if you want to check the like RA messages in general, click on the link that Kat put in for you.
Awesome. Okay. Well, we wanted to talk a little bit about habilitation services and for our HAB providers. The having full plans submitted is sort of kind of new because, of course, our PHE public health emergency flexibility period has ended by a couple weeks, so things are still new. We've had lots of questions about progress towards previous goals and objectives and what that looks like and how to submit it and what it shouldn't look like, what it's for, almost every single angle into that topic you can think of. For this meeting, we wanted to let you know that it is our provider that offers habilitation services, habilitative services. When a person's plan is renewing, you do need to provide progress towards previous goals and objectives to the care coordinator. Okay, the care coordinator will ask you for it. It may be for planning, it may be for the person to make decisions about services, it may be for a renewal support plan. Basically the information that you give them should be generally narrative. Okay, it's a narrative, meaning written summary about their progress towards each goal that they're pursuing. You could include should include a summary of quantitative data because these have measurable goals and objectives. Include a summary about that, give it to the care coordinator, put in writing statements of how much or how many times the person attempted an objective, as the case may be. Being descriptive is really great. Let the state know, meaning our review team and the care coordinator, know how the person has attempted an objective and how many times they've completed it in words. You can make statements about the outcome for the person based on their engagement with objectives and interventions. And interventions is, of course, what your staff are doing to teach this person and help this person following the plan. What did the person learn? Did a person need more or less or the same supports over time? These are ideas for you for how to make a summary of progress towards goals and objectives in words that is for a care coordinator to include in a plan. What it shouldn't be is only an attachment or, well, it shouldn't be just an auto-generated report from an application or a program that collects the data, like Therap data sheets. that's not going to be, it's great information. Of course, we want to see it, and you want to base your summary on it. You want to look at it and make sure that it's measuring, and your summary makes sense for somebody who doesn't know that person to understand how they're progressing. But it wouldn't be the only thing that you provide to a care coordinator if they ask for progress towards previous goals and objectives. It's not, it needs to be broken down so that the person can understand, the care coordinator can understand, and I know care coordinators understand TheraP sheets and other kinds of data sheets too. I'm not trying to say that, but it's not going to be acceptable if it's just a table graph sheet from, you know, an automated data collection application. Anything to add, team?
Other concepts that will be important for that would be worth documenting as a provider would be, did you learn how someone learns? Like maybe over the course of time, you learned that they're an audible learner or they're a visual learner. There are things that can help that don't necessarily translate to data points, right? Like it doesn't look like just points on a grid of like, how many times did we do this and they successfully did it. Sometimes progress towards previous goals is acknowledging different things about that learning process that improves your trajectory for the next planning year. So when we're trying to give you examples of other narrative features that you can include in your progress towards previous goals, we're asking you to review how things went over the past year, not just from the counting of like the objectives and interventions offered, but also as like an overall approach towards the teaching, which is, I mean, that's your specialty. Like you're really a teaching service and specializing in engagement and how to connect with that. And what you want to be able to give is sometimes those tidbits of information can be helpful to the entire planning team because we don't all work within the same service environments. So someone may never have encountered that an individual learns a certain way because they're just never in an environment that would allow for that. And that can open a door in different contexts. So we're asking you to think beyond, you know, we're putting together this data and we're just going to send it out, but actually review the data and think about it in an outcome focused way of like, what's the outcome for the person? What are things that supported that outcome over the time as you're preparing your plan so that when a care coordinator gets that data, they have to do a narrative summary of like the whole thing. Like, how did the whole year go? How was the whole year for that person? The summation of all of these different services for this person, for their personal goal. Every person, whether you have HAB services or not, if you have a waiver, you have to have a personal goal. So the care coordinator gives that progress towards previous goals, personal goal, the overarching, but then they're relying on you to give a snapshot of those specific service-based goals that are designed to help someone improve, maintain, or retain different skills. So there's many different pieces that you can analyze based on. That quantitative data, right? Like the tables, the percentages, they are helpful. They really are. But when it comes down to making a holistic approach, because that's our plan of care, excuse me, we don't even call it that anymore, but our support plan, that's the goal. That's what comes to my mind. Kat, do you have some thoughts about the Harmony interface piece that you think is important, that just to demystify Harmony and HAB? Because I know you get lots of questions on it.
Yeah, so like Karen Delight said, charts are nice and they're clear and they're clean and they look great, but they don't work in Harmony. There's no way for care coordinators to copy and paste them into the progress section in Harmony. Some have been able to do so by like doing all kinds of finagling of things. But but it's also not charts like that and tables are not ADA compliant, so that's a separate issue. So we recommend not to only provide care coordinators with charts and printouts from TheraP or other software that you have as the only way to capture progress towards goals and objectives. Because again, they cannot use and review teams discourage and they will kick back plans for attachments. So care coordinators cannot just attach progress towards goals and objectives in the back of the plan. That information has to be captured in the plan, in the correct section, and in the correct format. So tables, I love a good table and I love a good Excel sheet and things like that, but those are just not something that Harmony can work with. Maybe one day, but right now this is not something that Harmony can do. So most of care coordinators who try to copy and paste, actually try and copy and paste anything sometimes is an issue, but especially tables and charts and things like that. And I wish we had a way to connect Harmony to TheraP or other kind of software that tracks goals, but we don't. Maybe one day we will, but we don't right now.
Correct.
So there's codes and things that care coordinators enter in Harmony, but that's because that's how Harmony is set up. Those codes are not related to any goal tracking that providers do. This is just how Harmony was set up, and we are working on kind of clarifying that and maybe getting those codes one day removed or.
Yeah, the need and goal codes. They're like a label for actual thoughts.
It's a
and written
coding thing, right?
narrative.
Like it's a coding thing in Harmony.
And even though the state uses TheraP for example, for EVV, that is not related to waiver services. EVV is related to electronic visit verification, is related only to personal care right now. And it doesn't say, maybe someday it'll be related to other services. There's no plan on that at the moment, but it's not all connected. It seems that it would be that way, but it is not. These are the coding that a care coordinator enters is not related to TheraP or any other goal tracking. It's really more person-centered than that. It opens up other sections of the plan and the general codes. We used to teach them kind of like a label on a bucket. A goal statement and code would be like a label on a bucket, the one that Harmony has in it. The person's actual goal is entered in text, and the person's outcomes are entered in. So we're just hoping to clear that up. We do get a lot of questions around that, but thank you. Thank you both for those explanations. All right, habilitative services for habilitation providers. We're working on a training. Its nickname right now is HAB Services for HAB Providers. And I just wanted to show us the outline that we're planning. This will be quite a comprehensive course about habilitation. What is the concept? What is the purpose of habilitation? How is it person-centered? What is a goal, an objective, and an intervention? Comparing habilitation services with non-habilitative services, and who delivers habilitative services, like the qualifications of the provider and what services do this. A closer look into goals, objectives, and interventions. In our regulations, we use the terms acquire, maintain, and improve. So we'll sort of dive into those as definitions. And it'll have a segment about what is a goal, developing and writing them. What is an objective, developing and writing. Who does what? Means, is this the role of the care coordinator? Is this the role of the provider? Is it a blended role? That type of thing. And then it'll have a segment about teaching skills for habilitation services. So a lot of us doing habilitation have been doing it for many years. This is just to add to your skill set, or maybe you could incorporate it in some of your 101 training that you do with your agency. But some basic ways of teaching a habilitation service, through a habilitation service, which is about acquiring, maintaining, discovering new skills, that type of thing. Teaching methodologies, giving people an opportunity to practice the concept of error-free learning, getting people's attention as step one, using patience, reinforcement, modeling, backward and forward chaining, total task chaining, verbal prompt, physical prompt, reminders, and fading supports away. Those are very basic teaching concepts for people who would use habilitation services for that.
I don't care. You just have to do two. And that earns you a little bit of screen time.
I hear your mic is on, so
I muted them.
okay, thank you. I can't see anything but my, what I have sharing. Thank you. Okay, so documenting habilitation services, we are going to tie that in with our existing documentation course. And then updating habilitation services and documenting progress towards previous goals and objectives and ideas for adapting interventions along the way. Some special considerations about habilitation services: behavior being a form of communication, how a person gets their needs met, helping people to get their needs met in safe, productive ways, and knowing the scope of home and community-based services, being able to identify safety risks and concerns when maybe a person's needs might be outside the scope of home and community-based services. Occasionally that does happen. And resources. So I'm excited about this course. It'll be comprehensive. Everyone will be welcome to take it. I envision it as a 4-credit course for care coordinators. And we just wanted to sort of get you excited about it and know that we're working on it. I'm going to check our chat. All right. Bulleted requirements listed in official policy. I'm not sure what that was pertaining to, the question. Let me look up here and see.
Can you hear me okay?
Yeah, go ahead.
I guess I was just asking, like, I've been kind of looking at the HAB program. I've watched the documentation training. I listened to the training you did on like the goals and objectives. And I'm also kind of struggling, like, as a provider, the best way to capture data and in which format. So I'm super excited about this HAB training. Like, I'm very excited. So thank you. But it's also not very direct in any place, like how we collect the data. I mean, it's subjective, from agency to agency. And so I guess I was just wondering, like, are these bullets in a policy somewhere? Or are we just saying like, hey, we have to change the way we're providing this data to care coordinators because of limitations in this Harmony system? Because I kind of think, like, as a provider agency, if I 100% agree, there should be some statements from us regarding, like, are we obtaining these goals? But to give a care coordinator quantitative data, like, there should be some responsibility there for them reviewing the data, because it's ultimately their plan, and they should be like seeing, like, are these services meeting my client's need as part of like their ongoing review of care. So for us to have to like track quantitative data and then also break it down for a care coordinator just for them to copy and paste it, like, what is their obligation in reviewing the data to make sure it's appropriate to the hours that are approved in these like HAB service blocks?
Okay. Well, you will sign the plan as a provider, right?
Yes.
The final copy of the plan. So that's a way that you can review what they wrote, right?
But frequently it's wrong. Like, frequently the data we send them isn't. I mean, we don't use TheraP as like just as an example. Like, we're not a TheraP provider in HAB, and plans come back approved that say, oh, this provider will be tracking it in TheraP. And
well, that is why you need to review the plan fully before you sign it and make sure it has your piece in it. It's also an opportunity for you to have something in the plan that works for you, wording in the plan that works for you. My best answer to this is, person-centered regulations mean that there's a person-centered reg, We have to be putting information about people into plans that they can understand and involve people in this process. So a person, I get that they can read a graph, but do we just hand people a graph? You know, we talk it over with them. If you can put that kind of thing into words so that somebody who does not work as readily with them providing the HAB service can convey that in a plan, this is going to be a lot more useful for the person's plan and for the use of their plan by them, perhaps by provider staff in the long run. And our COPs say that you must collaborate. There's a clause in the COPs that say that we have to collaborate in service
But
providing. So
I agree with that, but that's not what you're asking. Like if we give a chart that shows like, oh, an objective or some type of quantitative data that says, oh, this objective was attempted this many times and this method versus this method. And then we're essentially taking that same data and just putting it into a sentence when that also could be something a care coordinator does into Harmony. That's not collaborative. That's just us feeding information. And really, like when Harmony first came out and we were testing it as groups with care coordinators, the idea was for that section to somewhat open to the provider agency so we could put in some stuff. But like we don't own it, and we certainly don't sign on plans that don't have the information that we always want. But also there's no requirement for every provider agency's signature to exist on the plan when it's submitted. So I just think like us taking quantitative data and making it a statement of qualitative, that's not collaborative. That's essentially making something fit into Harmony. But notes and attachments exist in Harmony and many features. So, and then someone also put in a chat after me that it can occur. So I just think, I don't disagree with all the things you're saying about like the outcomes and the importance of those things, because people are more than data. But saying it's like a provider's responsibility to submit it to a care coordinator just for entry in Harmony, like that's kind of hard for us to swallow because we're making concessions and many processes to support care coordinators and the Harmony system. So I'll leave it at that, but that's my general statement. Thank you.
Well, I appreciate that. I get where you're coming from, especially you mentioned that kind of situation where you've given information and then you see not the information, accurate information put in the plan. That is concerning. And if that is routine, we would encourage you to put in a quality assurance report, because it is important for as a team that you're on the same page for that client's outcome, like the outcome for them. And I think that I have seen this phenomena for a while. Right now, it is quite confusing as to who owns what, that qualitative versus quantitative. Of course, that quantitative, the data, is going to come from the agency. That makes sense. You're the one delivering the service. But when you come to the data itself, needs context to it. And that's the quantitative information that you will be providing about that. Context to the data. That's not the same as kind of the overall arching. The care coordinator has to review all HAB services, all the different pieces in a support plan, and provide a quantitative description of the overall plan year for that individual. But context does need to be given, because you can have this data that spits out that someone was successful 100% of the time, but it's a health and safety. And so, of course, it's going to be 100% of the time, because that agency has to ensure that they safely, do whatever, cross the street or whatever. Like, of course, they're 100% going to get across the street safely every time. So you have to give context to that. We made it 100%, but we're going to have to maintain this long term because there's health and safety concerns that need to be maintained. So it's less about analyzing everything, but instead giving context to data of what does this data really mean in plain language, especially when the data can be somewhat misrepresentative to the actual piece of like the outcome. Like it says it failed 100% of the time. It's like, did they fail 100% of the time, or were there like different barriers? Was the goal and the objective set just it didn't work effectively? You have to give context to that. Because the care coordinator wasn't at that experience, that delivery of service, and isn't working that one-on-one with the person, they're not going to have that context. So I am concerned that an agency would refrain from giving context to data because that is not an accurate holistic picture of what that service delivery looked like for the person. I do hear what you're saying, but give it some like we're asking for context to data because it's not something that can always be it's not something that may always make sense. The data doesn't always make sense upon looking at it. It just doesn't compute, and it's not something that's going to be picked up if not for the agency's context to the situation, to maybe staff turnover, to maybe like someone was having, like they had a change in transportation or home life or something. Those sorts of things the care coordinator may know, but there are times when they may not. So it's part of an agency's planning team, being a part of that planning team to give context. Sometimes all of that context doesn't make it into the plan, but if it really impacts what that data means, I would be hesitant to sign off on a renewal if it wasn't accurately represented. Hopefully that gives context, but that's the point.
Yeah, I really appreciate your explanation. I think I would just suggest like maybe rephrasing that bullet that it is more similarly phrased to what you just said, because that actually helps me understand what we're looking at here. Because I think mostly what people are, the way we get the feedback is like, oh, just take what's right there and just change it to a sentence. And so to me, that just seems nonsensical. So yeah, thank you for explaining that. And maybe just like rephrasing that bullet, I think would help providers understand what you guys are asking for. Thank you.
Yeah, it's not about formatting. So like it's like the Harmony stuff, the tables, the formatting of it's going to be messy no matter what. We can change the system, we could do something else, but there's always this game of like formatting it. But we're always going to struggle with it because that's just the nature of paperwork. We're taking real lives and putting it on paperwork, okay? So what I'd like us to think about is how can we make this data actually makes sense to people and tells the person's story. So that's really what we're targeting for and what reviewers are looking for. And if you're ever in a situation, this is just a plug for office hours. If you're in a situation with agencies and you're like, you're a planning team, the care coordinator agency, HAB agency, whatever the dynamic is, and you're really just struggling on a frame up, just come to office hours as a team. We're happy to work with you guys and trying to sort it out so that you can get your support plan in successfully. That's really our goal for you. So that's why that's a resource. Ashley, I see your hand up.
Thank you, ma'am. I have a question. You interact with care coordinators a lot. Are they under the impression that agencies are to provide the data, qualify it with context, and then also write a narrative? Or do they know that they own a piece of this process as well? Like, where is their headspace?
I think it's mixed results. I think it varies. So, and some of this is self-fulfilling prophecy, right? Like because teams have done this certain ways, different teams have made concessions and like all these different things. I can't remember if it was Jenny or someone earlier was like, it's just never the same. It's never a same approach. And that is a blessing and a curse. It's a blessing in the sense that every planning meeting, every plan is going to be customized. But the curse of that too is that some people have maybe inaccurate understandings of everybody's responsibilities. So that is another big part of why we're really emphasizing this conversation, why we're developing this training, is because we're seeing mixed results. Not all care coordinators are understanding the let's just say it with the 10-point Scrabble word of nuance. Like, it's very complex of like the agency is responsible for the quantitative data and giving it context, right? With qualitative explanations, all right? A care coordinator is responsible for the explanation of the whole picture between multiple service providers. When you have a situation where someone has multiple HAB providers or has shifted between multiple different providers for the same service, that care coordinator is really crucial for giving that quantitative context, to give the context of we had to try different approaches with different providers. So Ashley, I don't have like an answer for you. Some care coordinators know their role and some are learning in different ways, but we're going to work on that, and starts with a conversation like this.
Thank you.
Mm-hmm.
Thanks, Delight. That was super helpful. We definitely appreciate your feedback on our messaging. So it's a great gift to us. And I just wanted to shoot out there that we have trained on who does what and responsibilities and collaborations like this before Harmony. Many of the materials that we draw upon for some of our earlier attempts at, training Harmony with who does what are based on older materials. It is not a new question. So it is truly collaborative. Like, for example, a care coordinator could be new to the person and the provider's been serving them for most of their life. So this is where a provider is going to be able to give a lot of context to why services are requested, and probably going to have to help out with that, at least in the first renewal plan. And there's a myriad of other kind of scenarios that would also contribute to that. So anyway, thank you for the conversation, and it's ongoing. I just wanted to call attention to, so we have about 10 minutes left. Our general reminders. We have our individual and family quarterly info share. People and their family members welcome to come to our information sharing sessions. And the times that we offer them are listed. Of course, some have already happened, but we have September and December 31st. So that's available for people over the noon hour if they want. Feel free to share that. Our info sharing session that we're having here is listed as well, and that is a registration based session. Provider support office hours. We want to remind us that we do have office hours every week for care coordinators and all provider types. Provider support is every Thursday from 3 to 4. Open Zoom with the training team and our care coordinator liaison too. And if you have protected health information to share for a particular case, we can open an encrypted Zoom room. So you can share that with us and we can discuss what you have going on and hopefully help out. Starting in August, assisted living licensing staff are going to come to our office hour session the first Thursday of the month. So our current and prospective providers of residential services are welcome to attend. Bring your questions, and Nate and his team will be there to help you with your licensing questions. We also have individual and family office hours. An individual or family could come to an office hour and talk about their particular situation in an encrypted room every first and third Monday. And we have our YouTube channel link where we post our recordings. We have our policy YouTube channel with our public outreach for the public outreach sessions that we have regarding new regulations and changes like that, changes to our waivers and things like that. And our Training Academy site, where you will find you can, if you have not already established a learner account, that is where we'll be posting all of our trainings from now on, and including the habilitation HAB services for HAB providers when it's done. We're hoping to have that done in about 3 months, give or take. So give us a little bit of time. It'll be nice and comprehensive. So that will be available. I'm sure we'll talk about it before, again, before it's done. And that is what we had for today on our agenda anyway. Do you want to add? Go ahead.
Yeah, I just really would love for even just one or two of you to come to our Thursday session with licensing to just check in, because we really advocated for them to join us once a month and have that. So if you come, please have a question so we can give them like a realistic experience.
We want somebody to show up. If nobody
we
shows
want people
up,
to show
we're
up.
going to be embarrassed.
I, for one, am excited. I have never met Nate. I talked to him many times. I don't know what he looks like, so I am looking forward to looking at him on Zoom. Even if that means we're all going to stare at each other and just be like, this is great catching up, But it would be nice if we had some providers, with,
Right.
And
Yeah.
Amanda's already saying she's got a million questions. Great, thank you so much.
Thank you.
And if you do not have any questions, and if you know of any assisted living homes or group homes out there that may be having questions, and because they may not have time to come to this meeting, pass this along and let them know that they will be there, and that's a great place for them to come and ask questions.
Or even potential providers, maybe somebody.
Yeah, absolutely.
Yeah. Maybe somebody's
Potential.
thinking about being, opening an ALH, and they don't know what to do or how to do it. This would be a really good place for them to come and talk to us and talk to residential licensing.
And build that rapport and connection so that you have an idea, so that you guys are on the same page on different scenarios. It can be, or paperwork. Of course, there's always paperwork, but just getting, if you're working on creating a new home that may be a little unique and you have questions on how to make it happen, this is the right avenue to have that informal conversation before you take that leap into paperwork to make it happen. So please stop in first Thursday of August. I believe the date is, let's make sure we have the right date. The 1st, August 1st, 3 p.m. Be there, please. But that's all we have for you guys today. If you have any other questions, we do appreciate the conversation and digging deep. We like these kind of chats because we enjoy learning with you and from you, as we're all in this together. So please, do not hesitate to reach out. But with that, if you have any other questions, you'll feel free to drop them in, but we can also end early.
5 minutes early.
So much time.
Amanda, go ahead.
Yeah, I had a question that was a little off topic. I think there was a lot of chat. When a care coordinator requests an extension for a service plan or a support plan, is there documentation that goes with that and what the response was from their powers that be? And is there a limit to the amount of extensions they can have?
So I answered it in the chat, but there's no really process for extensions. Plans are due 30 days before they expire. And so even if the care coordinator lets the review unit know that they're going to be late, they're still going to get the 5-day and then the formal 15-day notice are still going to go out, because that is the process that the review teams have. There's no number of extensions, and there's no such thing really as extensions. I think care coordinators let review units know they're going to be late, but that doesn't stop those notices. So as long as they submit the plan before it expires, there is no closure done. But there's
Well,
always a
I-
risk of closure if the plan is submitted after it expires.
I have a plan that expired like May 26th or 27th. And we finally got the care coordinator to reply back this morning or late last night saying that they had gotten an extension and it was no big deal. And we've kind of had a chronic issue with this. So
I would recommend doing a QA report. So this is
guys,
like a
we've talked
CIR
about
QA
this.
report. Right? You can do that, the family can do that, the recipient can do that, because if there's no plan, then you can't bill. And the person is not really receiving services, right? So that's serious. I'm not aware of a process, but if you want to email me, Harmony, we could take a look at it. But my understanding is, because we did talk to review teams about that, is that they don't do that. I'm assuming this is some kind of like a one-off special circumstance of sorts.
Oh no, ma'am. I would
but-
say 70% of this particular care coordinator's plans have been late over the
That's not
last 2
great.
years.
That's not great. I'm gonna send you an email.
Yeah, I
We
would
can talk
recommend a
offline.
quality assurance report. The only formal thing that happens is that in order for the plan to be reviewed, the care coordinator must submit a late support plan form indicating the reasons why it's late. That is the only
And is there
formal
any point
process.
that SDS is like, oh, this is a red flag because most of their care plans are late?
Yes,
Yes.
There
Yes.
is.
there
Yes.
is. There's a data, we explored this because we were always something more to learn. But
Always.
there's an entire report that gets generated and sent to the quality assurance team for however many, for the late plans for care coordinators.
It's
So that's the
timely
whole
plans
thing.
is one of our assurances to CMS. So CMS measures us on that. So it's going to have a process attached to it. That's to that level of being important for us.
That's all great information. I'm going to be very happy to share this with my team and kind of decide what our next steps will be.
I can say that I have heard those unique circumstances where someone has a change of status report has gone in because someone is hospitalized. That has happened, and it's like, well, we can't really do the plan. We can't get them in. We can't do
Sure.
that. So that those do happen, and then there's kind of like some interaction where they check in with like SDS reaches out and they're like, oh, well, I can't do the plan because they're hospitalized. And then, we're trying to get it onboarded and get the discharge planning. So the discharge planning can happen and results in like a late plan.
Yeah, that
But
makes
that's-
perfect sense to me. That makes absolute sense to me. And I
That is-
understand that.
Not what you're describing though. So, because you're describing something very different, I would just put it out since all of you are here. It is a CMS requirement to have support plans in place, especially for individuals like you're renewing support plan, because we want continuity of services. These individuals are at an institutional level of care, and so we want to make sure that services are in place consistently over time. So when we have late plans, there's a requirement for that late plan form, and the notices and closures are very dialed in, like they come out very automatically because we need to make sure that services are in place.
I assure you, I am typing my team as we chat. This is great information to have. And hopefully it won't be a continued chronic problem.
And I put my email in the chat if you shoot me an email with like either the
I
Harmony
appreciate that.
or the
But
care
like I
coordinator.
said,
Yeah, we could take a
in
look.
very many other forums that in smaller towns, you have to be very careful how you approach things. So
I grew up in rural Alaska. I can appreciate that.
yeah,
I understand.
Yeah.
Well, okay, we thank y'all for joining us today.
Yeah, thank you so much. Thank you, Cassandra. We'll go ahead and close our session. We appreciate you, and come see us at office hours if you would, please. Okay? Thanks, everybody.
Thank-
Goodbye for now.
Bye. Thank you guys.